things maybe things that you experience after you smoke your cigarette initially. So obviously it causes bad breath. If you've ever smelled anybody who smokes, you can sort of get that quite noticeable smell. Um, it causes the shortness of breath. It increases your blood pressure. It increases your heart rate. It causes a headache and nausea. Um, and these are all the things that can occur even after smoking just one cigarette. This is not necessarily from smoking regularly. Long-term side effects, there have been many studies, and there's a wide range of diseases and harmful long-term effects that they have recognized from smoking cigarettes. It reduces life expectancy because of the complications that come up with smoking significantly. So the World Health Organization actually identifies smoking as the #1 avoidable cause of death in individuals in the United States. So this is significant because all of these issues that come up from smoking are solely dependent on the fact that you are smoking. So this is very avoidable. This is something that can be prevented and causes unnecessary death. So it reduces life expectancy because of all of the complications. It greatly affects your lungs, causing respiratory diseases such as asthma, COPD, tuberculosis, emphysema. And it does this because the smoke that you're inhaling causes irritation and inflammation to the lungs and causes the air passages to make more mucus, and it's typically thicker mucus as well. So it's really hard to cough it up, and you're constantly producing extra mucus. This is just a breeding ground for infection and disease, and that is exactly what happens when you smoke. It can also cause heart disease, stroke, and cancer because it clogs arteries and causes buildup. And so those are sort of things. This diagram that I've included kind of shows all of the different ways it can affect your body as a whole. It's not just your lungs, as many people may think. It can cause many different cancers that you can see on the left side and the chronic diseases on the right side. And all of these I've seen in patients who have come in, and they're typically things that just get worse, especially if you continue to smoke. With these diseases or cancers, they get a lot worse, and they're a lot harder to get rid of. Okay, so methods to stop smoking. We've identified the reasons why we should stop smoking. There are lots of them, but there's also a lot of methods that currently available these days to help us stop smoking. So one of the first ones is replacement therapy, and this can be done in conjunction with your doctor. Speaking to him about the best replacement therapy is going to be ideal. There are examples such as nasal sprays, inhalers, nicotine patches, which you can wear, prescription medications as well. So all of these are options that you can replace with smoking cigarettes, and this will help curb the craving of actually smoking as well. And e-cigarettes, which I initially mentioned as well, are kind of a bridge. They can contain less nicotine. There's a lot of harmful additives as well in those currently, but they can be a useful replacement therapy and not as detrimental as smoking a physical cigarette. Avoiding triggers. This is going to be important. Identifying things that stress you out. Triggers such as if you always smoke at a bar, if you're smoking at a party, identifying environments or triggers that make you want to smoke and avoiding these or replacing them with a different activity during the time. So if you're stressed and your release is smoking, you could try something like chewing on candy, chewing on hard seeds, chewing gum. All of those things, it gives your mouth an outlet, a way to do something other than smoke. Physical activity, this is a great one because physical activity helps curb those cravings as well. Going out for a run, a jog, doing chores around your house, all of these are examples of activities that you can do that help decrease those stress levels by just, you know, running it out, getting all of the stress gone. Relaxation techniques are also a great example. You can try deep breathing exercises, muscle relaxation, yoga, visualization, massage, music. All of those are relaxation techniques to help with the stress of either stopping and not having a cigarette available, as well as accountability. I think accountability is probably one of the most important methods of smoking cessation because you need somebody who is there who is going through it with you and is keeping you accountable to help you stop smoking, and just so that you know you're not in it alone. This could be a friend. I also, in this next slide, included accountability coaching. So these are online resources. There's thousands of them out there. If you search accountability coaching, you'll see all of these different resources. And these are just the top 3 that I've come up with. Quit.com, Quit Assist, and American Lung Association. All of these resources include a helpline and typically include people you can speak to over the phone to help you stop smoking. So they're going to coach you through it, they're going to talk to you, they're going to help be your accountability partner to keep you going when you're trying to quit smoking. And finally, we will talk about benefits to cessation of smoking. It greatly improves your health status and quality of life. Even 20 minutes after smoking cessation, you'll start to note these improvements. Your blood pressure and heart rate will normalize, which those are those short-term effects of smoking. Your tissues will start receiving more oxygen. You'll be able to feel yourself breathe easier, and your risk of premature death will greatly decrease. Your risk for disease decreases, and it reduces your financial burden. So you're not constantly going out buying these expensive habits and spending your money there. You'll have extra money to save. So as you can see, just from all of these, you can see that there are a lot of negative short-term and long-term effects of smoking. There's a lot of methods these days to stopping smoking tobacco, and there are significant benefits to smoking cessation. So some of these are the post-presentation quiz, just 5 questions about the information that we went over and reviewed. And here you can see the references for all of these that I've included in this presentation.